Good morning. My name is Cynthia Sierra, and happy Health Center Week to everyone. Happy National Health Center Week. Please come and take a seat in the shade under our tents, and we'll begin. We're so grateful that you're here with us, and it brings me great pleasure to be in such esteemed company this morning for this really special event. Without further ado, my privilege to welcome our board president, Anita Christie. Thank you.
Good morning, everyone, and welcome. This is a very important time for health centers, not only in Massachusetts but across the country, so we're really happy that you're here to celebrate with us all the work that we do at community health centers, particularly Manet. We're so proud of all of our staff, everybody who participates in the care of our patients, so thank you again all for being here. I would like to introduce, first of all, the board members that are present today. We have Grace Murphy-McCullough, who is in the back. Hi, Grace. And Jane Casilius. Without them, we would not be able to do the work of the board, so I'm grateful to have them as partners and colleagues. I'd also like to take the opportunity to introduce some of our elected and city leaders. First, Mayor Koch, thank you so much for being here. Representative Bruce Ayers, oh, he's in the back, hello. Superintendent Kevin Mulvey. Assistant Superintendent Aaron Perkins. And we also have representation from Mark Sturman, who is the Chief of Staff of Senator John Keenan. And Hannah Murphy, who is the legislative aide representing Tacky Chan. Thank you all for being here today. It really is a privilege to serve on the board. I am a lifelong Quincy resident, so have seen many changes from not just our downtown and our area of Quincy, but actually within healthcare and Manet in particular. We have grown really enormously to serve the people in the community here and in Taunton and Attleboro. And it has really been a privilege to be part of the board that has really seen some of this growth actually in action. So I really am grateful. And with that, I would like to turn it over to Cynthia again.
Thank you, Anita. So what a special day it is here in the city of Quincy, and for all of our health centers. We're one of 37 in Massachusetts. There's 1,600, if you will, health center organizations that serve 52 million in this country. So we are the largest system of primary care. And today is special for several reasons, and one of them is the opportunity to welcome, if you will, Anita mentioned our Superintendent Kevin Mulvey, of course, our Assistant Superintendent, Dr. Aaron Perkins. And so that's a simple introduction and a way of saying, welcome, Superintendent Mulvey. Pleased to be in your company today. Please join us.
Thank you, Cynthia. How about a round of applause for Cynthia and Anita? Thank you for everything you do for the city of Quincy and the Quincy Public Schools in particular. Good morning, everyone. It's great to see everyone on this beautiful day. Of course, it's a pleasure to join you as we celebrate National Health Center Week and recognize the extraordinary work of Manet Community Health Center and the dedicated professionals who provide compassionate, high-quality health care to our community each and every day. On behalf of the Quincy Public Schools, I want to congratulate Cynthia Sierra and the entire Manet team for their unwavering commitment to improving the health and well-being of Quincy families. Your work changes lives, and we are grateful for your partnership every day. Today is also an exciting opportunity to celebrate the tremendous progress we're making toward the grand opening, exciting information today. Grand opening of the Manet Community Health Center at Quincy High School. And thank you, Cynthia. Looks beautiful. This school-based health center represents far more than a new facility. It represents our shared commitment to ensuring that students have access to the physical, mental, and behavioral health services they need to thrive in both the classroom and in life. Projects like this are only possible through collaboration, and I'd like to express my sincere appreciation, of course, to Mayor Tom Koch and the Quincy School Committee, of course, for their leadership and steadfast support of this project. Thank you, Mr. Mayor. There are a number of other people I'd like to thank as well, if you could just hold your applause to the end, because there are so many people that made today possible. But also, of course, I'd like to thank Assistant Superintendent Dr. Erin Perkins, Public Buildings Commissioner Paul Hines, of course, Cynthia Sierra, and the outstanding team here at Manet Community Health Center, including new team member Mara Papil, who will be helping us with this new center as well. James Fatsy, Sean Glennon, and the dedicated staff in the Quincy Planning Department, State Senator John Keenan and State Representative Bruce Ayers for all of their work and believing in this vision and helping to make this a reality. Together, we are building something that will have a lasting impact on generations of Quincy students to come. I look forward to celebrating with all of you again when we officially open the doors in 2027. Thank you. Congratulations on National Health Center Week, and thank you for all that you do to make our community healthier and stronger. Thank you all very much. At this time, it's my honor to welcome to the podium Mayor Thomas Koch. Mr. Mayor.
Thank you, Superintendent Mulvey. It's a joy to be with you here today. We've been here on a number of occasions, Cynthia, celebrating all kinds of cool things.
Absolutely. Yes.
And nobody does it better than Manet. Really, when you look at the healthcare changes in the world of the last decade or so, in my view, you can't get better than health centers for really providing that compassionate care at a good price point. And you guys do an outstanding job, so I'm grateful for that. And you know, we talk frequently about city, and we're a big city, 7th largest in Massachusetts, but so much more than the bricks and the mortar. And we're a community, and you actually have community in your heading. So I'm so proud to be the mayor because we have a great community. We have a great community because we have so many wonderful community assets. And Manet Community Health Center is one of those great assets. We have a lot of wonderful community nonprofits that assist us in government because we can't do everything in government to really make it possible for people to live with dignity, in decent health, getting a great education, living in safety in their person and their property, all of those things. So working with so many in government, Representative Ayers, it's so good to see you. I know we work together on many projects over the years. Appreciate your service. Part of this money that we cobbled together to make it happen is CDBG money, and certainly our planning department, Jim and Sean, they do an outstanding job. He's not with us, but he's here on many, many times. I think one of the great champions of CDBG is Congressman Stephen Lynch. So we should always be mindful of that. He's always in our corner, does an outstanding job for us. You know, we hear a lot of stuff coming out of DC on both ends of the spectrum, but Steve Lynch just keeps working it. He's in the district all the time, and he produces. So I'm grateful for his friendship and his help on this project. I am so damn proud to be the mayor of this city for a lot of reasons. And another one of those reasons, in addition to work with Manet, is I get to work with incredible professionals like Kevin Mulvey, and Erin Perkins, and Paul Hines, and Jim Fatsies. And I could go on and on about the staff, the leadership, and the management of our city. I don't think it's ever run better, and that's really a tribute to the people that are in all these key positions that continue to provide the best in services for our residents, always meeting the need. I've worked with both of these gents for many, many years, and both you're going to be hearing from both of them in one moment. Paul Hines is a miracle worker. I mean, he and I go way back, but he's so damn talented in so many ways, and he gets $2 out of every buck I give him in all the projects. And you think about the various capacities of these department heads and what they have to deal with and what they have to do responsibility-wise. We've got, I don't know, 80 or 100 buildings around the city that Paul's got to take care of. Not an easy task. And that department, it doesn't go back that far. We're so proud of what that department has accomplished. We have real tradesmen working each and every day, fixing schools and firehouses. Don't have to worry about the old police station anymore, Paul. Thank God for that one. But he does wonderful work. I remember when the Broad Meadows got inundated with flooding, and Paul's quick, 1 in the morning, whatever time it was, decisions he made kept that school open. It could have been closed for 3 months if he had not done what he's done. So Paul does remarkable work. Superintendent, we hired the superintendent just when COVID hit. Yeah. Him and the team, him and Dr. Perkins, just have done amazing work, putting the kids and the families first and foremost in our school system. I always brag about us as a city, and one of those great brags is our school system. It really is outstanding. We meet the needs of families. It's great to see Jane and Mara Ray work with you guys over the years on the benefit of our kids. It's been just phenomenal. Jim Fassey's, he was my executive secretary for a few years before he took over the playing department, and Jim's done an outstanding job. We've seen a lot of development in the city. It doesn't just happen. There's a lot of work that goes involved in it, and Jim has a great team with Sean, Rob, and the entire team that really vet each and every project and work hard to make sure it's the best for our city. So I'm a lucky guy. I really am a lucky guy to work with some great people. I've got to cut out a little bit early. I was talking to Cynthia. In this job, you meet and work with a lot of people, as I just described, but you also work with a lot of community people. What makes Quincy so special is that people step up all the time. Dave DeBono was a HouseNet guy, 54 years old, and passed from cancer. We headed to his funeral. 2 teenage kids. We have a fireman, Brian Snow, who took his life over the weekend, leaving a 5-year-old. So I try to keep things in perspective. The crazy world we're living in, life is short, it's brief. There's a lot of joy in this world. I wish more people found joy in that. But whatever faith tradition you may practice, keep the families of both David and Brian in your prayers. It's a tough time for both families. So thank you so much for giving me the opportunity to say hello, Cynthia. This time, I'll bring up our next speaker, Commissioner Paul Hines.
Good morning. Thank you, Mr. Mayor, for your praise. I tried to duck out of doing this today. Is this on? All right. I tried to duck out of doing this today. I'm like, I'm not going to follow you guys up. I take care of the buildings. What do I have to say to a group of people who are interested in the health of the citizenry? Then I stopped and think about it. And particularly with the schools and the firehouses, we try to make the most healthy environment we can. Under the mayor's directive a number of years ago, we attacked the lead in our drinking water. The federal standard is still 15 parts per billion. No lead in water is healthy. So we set a goal of 0 and our own limit of 5 parts, 1/3 of the federal level. We've since gone back and doing another round, and we're targeting no more than 1 part per billion with that same goal of 0. We made amazing accomplishments in that regard with the support of Mayor Koch and the City Council through these years. Similarly, the asbestos in the buildings. They were loaded, built in the 40s, 50s, 60s. It was everywhere. We've been taking it out. We've taken out so much asbestos, the state regulators thought we're sending in bogus reports. So we try to make the environments clean for our firemen. We've done it to the libraries. We're doing it to the schools to make it as healthy as possible, to help avoid people getting sick. This project's unique in that we're providing services, and I say our department provides the stage that everybody else performs on. But we're going to provide the stage in the shadow of Manet's birthplace in HouseNet, where people who are sick or looking to avoid being sick, people that need information, have a place to go that's new, it's modern, and it's close. And it's expertly staffed with Manet. So that's as far as I want to go. That's all I have to contribute today. But enjoy. Congratulations on this. We're looking forward to executing, and it will be done. Thank you.
Oh, this man needs no introduction. Speaking of ducking out early, I'm going too if he gets the microphone. This is the planning director, Jim Fatsey.
Am I lucky to work with these people? And are we all lucky to have you and Cynthia and the Manet team? We've come a long way here. I mean, I think of the times I've come here, and it's, you know, for a X-ray unit, it's for just the existence of a place for people, the real people that need day-to-day assistance and a hand up, not a handout. And it's a pleasure to be part of something anytime we have a little piece to do with this. Planning and Community Development is very proud to support this project through an infusion of $150,000 in community development block grant funding for planning, architectural, and engineering services. And I want to echo the mayor's sentiment. Without Congressman Lynch, this would be a dry well, and that's a fact. And without folks in the state like Representative Ayers and John Keenan and all the people that you see at these events all the time. The school system in the city of Quincy is an incredible place where incredible things happen. I'm one of those few guys that can say that when people say, so where did you go to school? I said, Quincy Public Schools. No, where'd you go, you know, for your, you know, your real education? North Quincy High. I had the grades to get in there, so I took advantage of that. And, and you know, what we forget is that Manet Community Health is the longest running, continuously operating CDBG-funded organization in the entire country. It's a big country. And it is very fitting that the CDBG programs continue to play a role in the expansion of this incredible agency, which provides quality, affordable health care for all. I'd like to recognize Sean Glennon, who is our Community Development Director, doesn't miss a trick, and has the added talent of attracting incredible people to work on our team. Also, Rhiannon Gorham, who is the Community Development Planner assigned to this project. She's here. Rhiannon, where you at? Oh, there you are, right up front. Gotcha. Sherry Zoe, who is not only our Housing Development Director, but she's also our Federal Grants Compliance Officer. I've sit through almost an annual audit with the feds. They're very fastidious. I once said, why do you come all the time? He says, because we can come here, it all works out, and we can go home, and we can check off another one off the list. And I said, keep coming. And again, this project would not have been possible without their efforts, as well as the partnership with our fellow departments. And Paul's terrific. I don't have to talk about the superintendent and his team. Excellent. And then, of course, Manet Community Health, what management team they have. And then the guy that I have the pleasure of working for, he put a headlock on me about 18 years ago. And
20.
that's true, if we're counting a campaign period. Yes, it was 20. And he said to me, geez, Jim, I'd like to have you participate. And I said, yeah, I don't know what I would do. And he said, well, you know, I can find something for you. And I said, you know, Mayor, you know, I had a long career and I traveled a lot. I said, I'd like to stick around and be local. And he says, oh, we can keep you local. So I said, well, I'll give you a couple of years. That was 18 years ago when I took the first job here. I'm in my 19th. What this mayor has done for this community, oof, this is the difference. I want you all to recognize that you are going through a time where the city is experiencing greatness. A lot of back noise, I hear you, but greatness. And this is the man right here. So God bless you all, God bless us, and God bless Manet Community Health. Thank you.
Thank you. Thank you so much. And it wouldn't be a National Health Center Week, Mayor, without you. Your investments, your guidance, your support, your belief, your champion of our mission and the patients that we serve and the staff that we're really proud to employ. I wanted to recognize, and a bit of redundancy here, so please pardon, some folks that are not here and their importance and their relevance. Congressman Lynch, of course, has reached out, has sent his best, have been in touch. And yesterday we were in Taunton with Congressman Jake Auchinclosh, and as a federally qualified health center in such pivotal federal policy times, we couldn't have better support. So I wanted to recognize Congressman Lynch. And then Sean Glennon, yes, I interrupted his vacation with a text this morning to sort of share the joy and to thank him. And Mr. Paul Hines, you more than need to be at this podium because you're under recognizing your accomplishments in this beautiful project that I'll speak about just briefly. And I also wanted to recognize Mark Sternman is here representing Senator John Keenan. And I don't want to go into the Senate policy bill, but Representative Ayers, I do want to thank you on the primary care bill and Galen and what happened with that primary care bill last week. We are watching that. We are incredibly grateful, particularly the commercial rate floor. Thank you, Galen. Thank you, Representative Ayers. Back to Senator Keenan, back to Mark and Doreen that work for the senator. It was a field trip a few years ago to Manet at the Taunton Public Schools. I want to recognize our Director of Behavioral Health, Tim Como, that is intimately a part of that team. And we reflected on a few years in at Manet at the Taunton Public Schools. Superintendent John Cabral, last night we were speaking. We saw him yesterday. He sends his best to you. And Erin and the entire team. And the model there, so beautifully led by nurse practitioner Mary Cahill and Susan Francis, LICSW. It's what we like to call primary care plus. And so it is during operating hours of a school, it's primary care in partnership, if you have an existing primary care provider, in partnership at all times with the parent and the caretaker, in concert with adjustment counselors, school psychologists, teachers, and school nurses. And so there's that beautiful companionship between an LICSW that offers mental health counseling, supportive services, and then a medical provider that's board certified, a primary care provider in their own right. And it was Senator John Keenan that I believe sent Mark and Doreen down for a road trip, and I think it's safe to say, Mark, that there was a sense of being enthralled with that site, and it spread and it perseverated, and we welcomed Maura and we welcomed Erin, and sort of recognizing that point and click. We want one of those in Quincy. And so we very much went to work, and And when you look at the demography of the children and the adolescents in the city of Quincy, there is a need. And when you think about healthcare innovation, how do we innovate healthcare? How do we bring it to the patient? Whether it's remote patient monitoring, thank you, Sarah Follinsby, our Director of Quality, whether it's telehealth, thank you, Dr. Lily Young, and the providers. It's also bringing the care inside. And so this will bring the care inside. So those students that need us across the lifespan, if you have staff that need us, we will be there and we will be appropriately staffed. We will help with health benefits. We will help where we now understand there are some struggles with social health. There's some struggles for our families enrolled, as the Quincy Public Schools knows well. And we can make an impact there, again, in partnership with the parents, the caretakers, the school, the administration, and the wonderful families. So we couldn't be more humbled and grateful to bring school health right to your students, and just abundantly humbled and quite intentional to bring this announcement this week to this community. I wanted to recognize too that none of what we do at the health center is possible without staff and volunteers, and the majority of our volunteers are also our patients, and isn't that amazing? And the bolstering, the uplifting of academic medical center partners like Boston Medical Center Health System, and we have representation today from Dr. Ravin Davidoff. Thank you for your friendship leadership. Thank you for your guidance. And Tamaya Gupta is here. Thank you. And we'll talk a little bit about the pharmacy, because I want to save a minute, if I could. Please stay with me to talk about the staff on this most important health center week. So our Manet Community Health Pharmacy, we were gathered here last year, and my goodness, Mayor, we have never had a National Health Center Week, as long as I can remember, in Quincy without you and your company. So we thank you. Thank you. We thank you for your continuity of commitment to us. So we were on the other side of the building, and we hadn't cut a ribbon yet. We hadn't moved into ownership. In October of last year, we now own our pharmacy. An enormous undertaking, an enormous step for us, and so incredibly important in terms of seamless integration, exceptional service for our patients. Another opportunity where we're recognizing, if you will, the needs and at times the burdens and the hardships of our patients, because the Manet Community Health Pharmacy is going to do its best every single day to provide exceptional service in the language of the patients, integrated as part of our care team, but if you will, a resource that doesn't leave anyone else behind. And so pharmaceutical service and counsel and inventory right here for our patients. The savings from that program, incredibly important. The unfunded and the underfunded mandates of a community health center, a federally qualified health center, every penny of the savings from running our own pharmacy reinvested back into this health center, into what our patients need most. So if you're here, you have a minute, talk with our pharmacy team. Dave Morgan, recognizing you as a friend and a partner in lighting the path in terms of pharmacy, knowledge education. Our esteemed board member is actually at a pharmacy conference this week, Paul Jeffrey, who led the program for many years at Mass Health. I would be remiss to not acknowledge the engine that keeps this health center running every day. We're 365 running every single day, because we are for our registered patients, and we will be for yours too, Superintendent. We have on-call service. We're open on Saturdays, but Sunday, before and after hours, we're there for our patients, and it's the staff. And there needs to be a federally qualified National Health Center Week every month, because they need to hear it. They need to hear it, whether they are enrolling the patient, ensuring health benefits coverage, whether they are on the front end of the care, whether they're picking up the phone, whether they're perseverating the mission because they're on the revenue side of things, they're on the back end, making sure that this mission continues, whether they're raising funds, whether they're internally a communicator, whether they're externally a communicator, whether they're providing the care because they're the board certified, they're the credentialed, they're the licensed provider. Yes, we're very, very proud of it. Whether they're ensuring safety, they're ensuring quality care, they're ensuring the social health that wraps around the patient. So transportation, language assistance, pharmacy assistance, housing assistance, educational assistance. Those staff are here. Whether you're the staff that are lifting up new programs like our pharmacy, whether you're the staff that are developing our people, recruiting our people, and doing everything to retain our people, whether you are the staff that are bringing these events forward, creating them all the time to spread awareness of our mission, to remind us that every single day, all day, the patients are at the center of what we do. And the next right thing we do is always because of our patients. Whether you are the facilities team at 6:30 this morning when I drove by the building to come to work, my goodness, Marcia Mead, your facilities team was out here making sure that we had wonderful facilities. So we cannot say enough, whether you're, if you will, on the social health side, the medical side, you're on the behavioral health side. Thank you. My goodness, thank you for choosing us. Thank you for being part of us. Couldn't be prouder. Eye care, if you will, where we want to go in the future, helping us with that planning, specialty care. It takes all of us and every single one that works here. They come through the doors and they turn on the lights, and they do it for the most important reason of all, the patients. So on this Health Center Week, my goodness, we have so much to look forward to, Superintendent Mulvey, right? My goodness, and it's a community that did this. It's city leadership that did it. It's planning leadership that did it. It's the federal support for community health centers, and we're so proud of that identity and humbled on this week to be in your company. So our events team has lovely refreshments, cool refreshments for you. You know, enjoy this day, knowing how grateful we are for your presence, and thank you. A year later, my goodness, a year later, we're opening a site that is just going to be absolutely extraordinary, and reaching those kids and those families, and expanding access to primary care. And we own a pharmacy, and we want to keep them busy. So thank you on behalf of all of us here at Manet. Thank you.